Yes, good evening, my dear friends. Today we are going to discuss about occipital and suboccipital triangles. So earlier we have discussed about different triangles, and today we are going to see occipital and suboccipital triangles. So before going to explore this, please subscribe to my channel. Let us see the triangles, how they were formed, what are the boundaries, and what are the contents of that. And last and not least, we are going to discuss about the clinical aspects of occipital and suboccipital triangles and their contents. Yes, coming to the occipital and the suboccipital triangles, first and foremost thing which we have to expose these triangles. If we wanted to expose these triangles, we need to separate all the layers of the body one by one. So first and foremost, the skin and the superficial fascia. Here you can identify the skin. Just below that you can identify the superficial fascia, which is lined by the fat. And especially in this occipital region, we can identify it is abundantly fibrofatty tissue is present. So we need to be very careful when you are removing this fibrofatty tissue. Then after removal of these tissues, we can identify the biggest muscle called as largest muscle, trapezius muscle, which we can identify. After separating this trapezius muscle, we can identify another muscle which is running obliquely, and it is reaching to the mastoid process and also the lateral part of the superior nuchal line. Yes, we have seen the trapezius, and then after separating of this trapezius or underlying the trapezius, we can identify another muscle which is running laterally and reaching to the mastoid process, and also it is reaching to the lateral part of the superior nuchal line. So I will show that muscle. Here you can identify that. First thing, it is a ligamentum nuchae which is present at the midline, where the origin of the trapezius we can identify, and also the other muscle fibers which are arising from it, tendinous origin. That part is called as ligamentum nuchae. Is the ligamentum nuchae. And then the muscle which is running obliquely and reaching to the mastoid process, that it is called as splenius capitis. Splenius capitis. So here you can identify a triangular area that is called as occipital triangle. And then at the floor of this we can identify a vertical muscle which is extending upwards and reaching to the medial part of the superior nuchal line, that is called as semispinalis capitis. Then after that, yes, here you can see the triangle, that is the occipital triangle. Then what are the suboccipital triangles? Let us see now. So coming to the suboccipital triangles, so the first and foremost thing is most laterally, another muscle which is extending upwards and reaching to the tip of the posterior part of the mastoid process, that is called as longissimus capitis. Is coming to the suboccipital triangle, how it is formed and which muscles are forming this suboccipital triangle. So first and foremost thing which we have seen the trapezius. Underneath the trapezius we have seen the splenius capitis. Underneath the splenius capitis we are going to identify the suboccipital triangle. Okay, so what are the boundaries of the suboccipital triangle? First one is medial boundary, then lateral boundary, and the base. Then apex is formed by the fusion or joining of the medial and lateral boundaries out upwards, and the base is formed by another muscle. Let us see what are the muscles are forming the boundaries now. So medial boundary is formed by rectus capitis posterior major, and also minor is supplemental boundary. Okay, so muscle which we can identify here is nothing but rectus capitis posterior major. Then lateral boundary is formed by obliquus capitis superior here. Okay, and the base is formed by obliquus capitis inferior. Yes, this is rectus capitis posterior major, which is forming the medial boundary, obliquus capitis superior, which is forming the lateral boundary, and the base is formed by obliquus capitis inferior. So here you can identify the triangle. So that triangle is called as suboccipital triangle. So first we have seen the occipital triangle. Underneath the occipital triangle, we can identify the suboccipital triangle. Now, what are the contents of this suboccipital triangle? So first I will discuss about this nerves. So the first nerve is called as suboccipital nerve, C1, suboccipital nerve. So as it is exactly arising at the cranial end of C1 or atlas, that is called as suboccipital nerve. Then below this posterior arch of atlas, then above the second cervical vertebrae, we can identify second cervical spinal nerve, that is called as greater occipital nerve. Then below the axis, we can identify third occipital nerve emerging. So the three nerves which are emerging outside, those are called as dorsal rami of C1, C2, and C3. Dorsal rami of suboccipital nerve, dorsal rami of greater occipital nerve, dorsal rami of third occipital nerve. So these are the dorsal rami, which are the posterior branches of the spinal nerve. Okay, so these contents which we can identify. So exactly in the suboccipital triangle, so first nerve, suboccipital nerve, which we can identify. Then below this obliquus capitis inferior, we can identify the C2 and C3, means the greater occipital nerve and the third occipital nerve, which are just present below the obliquus capitis inferior. And in this suboccipital triangle, between these three boundaries, obliquus capitis inferior, obliquus capitis superior, and the rectus capitis posterior major and minor, in this triangle, first nerve we can identify, and also there is an artery. So that artery is called as the third part of the vertebral artery. So it is also called as horizontal part of the vertebral artery, and also the posterior arch of atlas. And the membrane which is present here is a posterior atlanto-occipital membrane. Posterior atlanto means atlas. Okay, atlanto-occipital membrane. So coming to the clinical aspects of this is cisternal puncture. So the cisternal puncture is done when lumbar puncture fails to take out CSF sample for therapeutic and diagnostic purposes. So needle is introduced in the midline just above the spine of the axis. So we have to be very careful here how they puncture. Let me show you that. So in this picture, we can identify this is the atlas, and this green color membrane is called as posterior atlanto-occipital membrane. Then below to this one, we can identify, below to this atlas, we can identify posterior atlanto-axial membrane. So just above the spine of the axis, we are going to pierce the needle. And collect the CSF. But when you're collecting the CSF through the cisternal puncture, you have to be very careful. You should not pierce deep. If it is passing more than 2.5 centimeters deep, you are going to puncture the medulla oblongata. And causes fatal effects. Here you can identify. Yes, let me show you how. Actually, here you can see this is the posterior arch of atlas. Just below to this, we have to insert the needle. Just 2 centimeters or 2 to 2.5 centimeters, we have to insert the needle. Yes. So if it pierces deep, you are going to disturb the medulla oblongata, lower end of the medulla oblongata, causing fatal effects. The next one is connection between suboccipital venous plexus and the internal vertebral venous plexus serves as a path of intracranial infection in carbuncles of the neck. What is this carbuncles of the neck? It is an infective gangrene of subcutaneous tissue following infection of hair follicles. So let me show you how these extracranial veins are connecting with the extracranial veins, which are going to connect with the internal vertebral venous plexus. Yes, in this picture, we can identify the vertebral venous plexus. So outside of the vertebral column, we can identify the venous, which are draining the venous blood from all these adjacent structures. If any infection is present, they extends inside, they communicates with the internal vertebral venous plexus. Here you can see we have taken a sagittal section in order to see how the internal vertebral venous plexus are present here. So outside of the vertebral column, veins are present. They are connecting with the internal vertebral venous plexus. Through this, the infection, it may transmits into the cranial cavity. Here you can see that how they are going to communicate with each other. Next one is the tortuous course of the third part of the vertebral artery in this region. may serve to damp down the arterial pulsations within the cranial cavity. But if it is affected by atheroma, movements of the head and neck may affect the flow of blood through it and cause temporary fainting or unconsciousness. Yes, in this part, in this suboccipital triangle, we can identify the third part of the vertebral artery that is called as arterial pulsations. Okay, so this is also a very important structure which is present in this particular region. Actually, in the massage centers, when you turn the head forcibly, you may cause the rupturing of this uh, vertebral third part of the vertebral artery, causes many fatal effects. Okay, so that is about the occipital and the suboccipital triangles. Here you can see the vertebral artery. So that is about the occipital triangles and the suboccipital triangles. So in the next class, we are going to discuss about other important triangle. So keep watching and don't forget to share, and please subscribe to my channel. Thank you, dear friends. See you soon with a new class.